Clap.
You got
Okay, now it's good.
it. Good.
All right. Welcome. Welcome to the May 3rd Thursday CARES webinar. My name is Derek Little II, and I'm the CARES Peer Workforce Coordinator for the Georgia Council for Recovery. But more importantly, I'm a person long-term recovery. What that means, it has been 4 years since I had to use a drink or drug to change the way I feel. As a result of being in recovery today, now I'm a better son. I'm a better brother, a better uncle to my nephews and my one niece, and I'm a better friend today. As a result of being in recovery today, I've been able to make a good amount of host of friends, and I'm also the youngest cares in the state of Georgia, which is pretty cool. Ha 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 ha. And yes, and I speak out loud about recovery because I know what it was like to feel like I wasn't worthy enough to have a voice. So I speak out loud about recovery to be able to encourage others to be able to share their voice too. Um, to
Wait, Derek, how old is that? You will never say how old you are.
I'm 23.
Oh, yay.
I'll be 24. I'll be 24 this Sunday. Um,
Great. Happy birthday.
thank you. All right.
Happy birthday.
So, okay. Today, Emily Ribblett will present Grant Writing Basics. This training is a practical step-by-step introduction for individuals and organizations seeking funding to support recovery for OUD, AUD, and SUD. The presentation covers the essential why, what, when, how, and who of grant proposals, equipping participants with foundational tools to develop competitive grant funding projects. Learning objectives include to understand grant funding landscape, to identify funding opportunities aligned with organizational capacity, to learn key components of a strong grant proposal, to understand the basic grant application process, and to explore strategies for Georgia opioid settlement funding opportunities. This will be interactive, so we ask for your engagement and participation. Some housekeeping. This will be interactive, so we ask for your engagement and participation. Please keep your microphone on mute if you are not speaking. As host, I will mute people as needed. Everyone who remains until the end of the webinar will receive 1.5 CEUs. You will receive a certificate from Alvin Cotton to go out probably next week. Anyone who shows up more than 15 minutes late or has to step away for that long may continue to attend the webinar, but they will not receive credit. Their certificates will likely go out early next week. You can search for the name Alvin in your inbox if you can't find their certificate. Make sure the name on your screen matches the name you want on your certificate. Make sure that and first we will do a poll to see who is all here. Okay, let us do a poll. All right. Wait a second. Who's here?
Derek, what's the policy on having their cameras on? They don't have to have their cameras on, do they? Does
I
it?
do not think so. No,
Okay. Okay.
no,
So Shay, you're okay. Shay said she doesn't have her camera. She's having trouble with her camera.
that's fine.
Okay. Oh, nobody did the. Oh, there it goes. I was like, where's
Yes, now the
the
poll is
light?
released. Y'all can do the poll.
I think they do have to have their name though, their right name for their
Yes,
on there
Yeah.
so they can get their certificate. You
yes,
There you
want
go.
to have their name.
correct. Please have the
Thank
name that you would like to be on your certificate.
you. Nice. Nice. Come on, come on, come on. This is great.
Okay. 5 more seconds. And all right, we're gonna end the poll. And
I didn't see the poll.
you didn't see the poll?
I didn't see it
No,
either.
not at all.
I
And
didn't.
I've been on before it started. I didn't see it.
Mine popped up.
Okay.
I didn't see one either.
Uh-oh.
Okay, well, it was the poll to see about who's here and to see if you were a cares or who it was. Um, should be okay. Let's make sure when the next poll pops up that you're able to see that when that starts, and then we'll get to that when her presentation starts.
Can
Okay.
everybody see my screen? Can you guys see where it says grant writing basics?
Yes.
Yes.
Okay,
Um,
great.
Yes,
yes.
ma'am. You see that?
No.
Okay,
Yes, I can.
okay.
Okay.
Yeah,
Now I got it.
All I can see is a little booklet on the table.
Yeah,
that's what we're
that's
looking
correct.
at. Yes, that's
Yeah,
right.
that's the first slide.
Okay. Cool. All right. So, all right. Today's presenter, Emily Ribblett, MBA, Certified Peer Specialist, Addictive Disease, CPSMH, and CARES 24, which was in 2017, has been in long-term recovery since 2015. Emily serves as the Assistant Executive Director for the Georgia Council for Recovery. She has worked on grant-funded projects in partnership with the Georgia Department of Public Health, Augusta University, Mercer University, and the Department of Behavioral Health and Developmental Disabilities, DBHDD, Criminal Justice Coordinating Council, and other organizations. Emily has overseen two successful federal building communities of recovery SAMHSA grants. In her current role, Emily supports all aspects of GC4R with particular focus on finance and administration. And now I give it over to Emily.
Derek, that was such a nice introduction. Thank you very, very much. And a happy, happy, happy birthday.
Kudos. That's a lot of accomplishments.
Thank you. Welcome everybody. Thank you for being here. I hope that this information is very useful to you. And if it isn't, please send me feedback about what you want to learn, and
Lost sound.
I will modify this. I will update it. I will add anything or take anything out that you don't feel is relevant, because I really think it's that important that this information help you get to where you need to be. And I want to do everything in my power to make sure that that's
Hey, M, you want mute? You want mute? If you could, unmute yourself.
Can you hear me now?
Yes, we can hear you now. We can hear
How
you
the
now.
heck did that happen? I don't know
Sorry,
what
that was me. That
happened.
was me. That was me. That was me. That was me.
Oh, you muted me?
Yes, sorry about
That's
that. I
okay.
wanted to mute everybody before we got started.
Gotcha. Thank you, Derek. All right. So, again, so grant writing basics. This is my "What's Right with Me" slide. This is just some of the things that are what's right with me today. And what I just want to point out here is that I am a person in long-term recovery, and what that means for me is that it has been over 11 years since I felt the need to use any mind or mood-altering substances. I am so grateful for my recovery today because these are my whys. I got engaged this year. Never thought that was going to happen. I love uh, being a grandmother. I don't know if there's any other grandparents. I love being a dog owner. Any other pet owners? Love ya. And then my family, my great family, they're going to come visit me pretty soon in a couple of weeks, and I can't wait. So I'm sure that you guys all have your why you do this work, and I respect you for everything that you do, and I appreciate each and every one of you. Yeah, just keep on doing what you're doing out there. Um, so again, I would love to hear what's right with everyone. We have a lot of people on the call. If you want to drop it in the chat, what's right with you today? Um, please share what's right with you, and I'd love to hear from all of you. But um, again, I don't know if we're going to have enough time. So if you don't mind, just drop it in the chat, and we'll check the chat, and we'll check in whenever we do a poll. Maybe Derek can read out some of the folks that what you share what's right with you. But I'll keep going so that we have time for questions at the end. Um, so these are our learning objectives. So what we want to do today is really understand the grant funding landscape. Maybe some of you are very familiar with the funding landscape. I know most of you are probably familiar with the Georgia Opioid Crisis Abatement Trust, or we call it GOCAT funding. Maybe some of you are familiar with DBHDD, or the Department of Behavioral Health and Developmental Disabilities. And then we have some other funding opportunities that we'll talk about as well. Some that you may not be as familiar with, but they are available, and I want to make you aware of them. There's a great organization called Georgia Center for Nonprofits. That's a great resource to tap into. I sent out some resource materials prior to the workshop. Hopefully those will help you. If you can think of anything that needs to be added to the list, let me know and I'll update it. So I want to help you identify funding opportunities that are aligned with your organizational capacity. That's really important. What I like to say about that is that, think about what you're really, really good at and what your strengths are as an organization. And you want to tie your mission into the funding source, right? So you want it to kind of complement the work that you do. And it just makes more sense. And you'll appreciate the fact that you're doing work that you love to do from a funder that you love to work with, right? So you want to learn key components of a strong grant proposal. There are key components. Beverly and I were hammering away today, working on a GOCAT proposal for the Georgia Council. And we were going through the key components of what makes our proposal really strong. That's what we're hoping. We're hoping to get it funded because it does have some key components that make it a very strong proposal. And then I want you to understand the basic grant application process. It is a process. It's tedious. I'm not going to lie. It's a process. But you guys can do it. Anybody can do it, but I strongly recommend that you don't do this alone, that you have someone or a team of people to support you, because it can become very stressful if you're trying to do it all by yourself. So take some time to explore some strategies for using the Georgia opioid settlement funding opportunities. I think we're a little late on the game on that since it's kind of due in the next 2 days, but hopefully you're already working on it and we can talk about some of these things. So let's move into the next slide. Why grant writing matters. Well, for those of you on the call, I don't know where you work or what you're doing in terms of trying to build your community up for recovery, get some support in for your recovery, community projects and nonprofit development, etc. You could be anywhere in the nonprofit spectrum of development. Grant writing matters because nonprofits really rely heavily on grant funding. It would be great if we could all rely on donors, and some organizations have wonderful relationships with donors. Just some folks who in the community just donate money and time. But grant writing really helps. Grants come in a lot of different forms, and they're very helpful when an organization is trying to grow. So some of the things that are important about grant writing is it helps you expand the services that you're providing to underserved populations. It helps you build new services and new programs. You can strengthen the infrastructure and staffing at your organization. You can build community partnerships, which I believe is really, really important. Recovery is all about connection, right? Recovery is all about community, right? And so working with other community partnerships is what makes us a wonderful ecosystem, I believe. And we want to support long-term recovery support services, right? How can we best do that? Well, we can do that through finding really great sources of funding and strong grants that will help us keep doing the work that we love to do. So, is this grant right for your organization? This is about capacity. This is about thinking strategically if the grant that you're looking at is right for your organization. So, just asking some basic questions. Do you have enough staff and infrastructure to implement this project? Are we in a position currently to be able to take on $50,000, $100,000, $800,000? Where are we in terms of our staff and our facility? Do we have QuickBooks in place or some other accounting system? Are we are we paying payroll taxes? Do we have a payroll system? Just ask yourself some of these questions, like where are we, and also ask yourselves, where do you want to be? What do you want to use this funding for? To build some of these things? To purchase some of these things? Do we need a database platform? Do we need a telephone system? Do we need to buy cell phones? Do we need to buy laptops? Do we need a printer? These kind of questions. When you want to ask what you already have, what you need, and are you going to be able to have the capacity to pull this off? So the next question you want to ask is, can we meet the reporting and compliance requirements for this grant? Are we going to be able to meet these deliverables? Deliverables are really important. But if you create a program in such a way that you feel really comfortable and really confident about the deliverables that you're providing, then it's a no-brainer. It's stuff you love to do anyway. But just keep it inside of your wheelhouse. Keep it where you know that you feel confident or you feel aspirational that you're going to be able to meet these reporting and compliance requirements. And let me tell you guys, everyone in the grant oversight arena are very particular about reporting and compliance requirements. And it's not, nobody's a bad guy. It's not because they're trying to be mean or any of the, it's just the nature of the funding. We've got to be very diligent about keeping records and reporting on what we're doing. And that means financially, that means from your programmatic side, all the way around. Just be very aware that it's important to keep good records. We want to know, do we have financial systems? As I mentioned, do we have financial systems in place that we can manage this kind of funding? Are we in a position financially or, a fiscally responsible position where we can handle this type of funding? And does this project, this is the most important one, does this project align with our mission and strategic plan? Is this something that we're really good at? Or is this something that maybe we're overreaching? Maybe this isn't the right fit for us. Maybe we could be part of another grant that somebody else has, and we could stay in our lane and do our work. We want to be really mindful and not to have mission creep. Your mission is strong. Stay within your mission. Your mission should be funded for what you provide. You don't have to go out there and reach for funding opportunities for things that you don't excel at. And where to find grants. So let's talk about this. So there's so many different sources out there to find funding, but they're tricky, and that's okay. You can find local funds, you can find state funds, you can find private donor funds, you can find even all sorts of funding. But let's start at the federal level. So there are federal grants. They usually come from the Substance Abuse Mental Health Services Administration, or SAMHSA, or there are grants called HRSA, which is Health Resource Services Administration. I sent out some PDFs, and some of these are listed on the PDFs that were shared. So please take a look at those, and those websites are available. What we've learned at the Georgia Council is that when you're applying for a big grant like that, it's really helpful to have partners. Sometimes it might be even better if they apply for the grant and we come along as a sub-grantee, which means we're still going to get funds, but they're going to handle all the management of the grant. Like, we just submit a programmatic report and an invoice to whoever applied for the funding, and then they pass the money through to us. We have done it that way. And then we've also had SAMHSA grants, as Derek mentioned in my intro. We've had two really successful building communities of recovery grants through SAMHSA. So I recommend try it, apply for it, go for it. If you don't get funded, at least you have the practice of working on it. So
Can
then
I ask?
state,
Can I ask? How do you get a notice of funding?
so that's a great question. And if you look on the, actually, I just got a notice the other day. You can go out to SAMHSA, and you can also go to grants.gov, John. Grants.gov is a place to find some of that information. But great question. Great question. Yes. And they will have notice of funding opportunities. I think I got an email, and I can share that email with you. I got an email the other day from SAMHSA about some notice of funding opportunities that are becoming available. So we are in grant season. Great question. So let's talk about state government funding opportunities. I have some slides on this as well. What we have at the state level is called Congressional District Spending, or CDS. If you reach out, find out who your local, not your local, your state representative or state House of Representatives or senators, go to their website. They have discretionary, goodness gracious, I'm tongue-tied. They have what's called discretionary funding. And they love to give it they want that money to go back to the communities. They are there to serve your community. So what you do is you get a hold of their staff. You can go on the website. They will show you where the opportunities are. Their staff are very, very helpful, very helpful. And then you get to know them. They will help you apply and walk you through the process. But I'm telling you, they're not difficult to apply. The application itself for this type of funding, for congressional district funding, is relatively straightforward. It's like a Jot form or a Microsoft form, and you just put in the basic information. We're going to walk through some of that. And then you've got community foundations. Community foundations are located all over the state. They just look up your county and community foundation and you will find information. The tricky thing with community foundations is that they have a lot of need in those communities, and they have a lot of folks who know about that community foundation. So you really want to try to get in with them and offer a solid proposal, and you might get it funded because that's what they're there for. Community foundations are literally set up to help support nonprofit organizations in the community. Then you've got corporate foundations, like for instance, the Arthur M. Blank Foundation. They just built a hospital. That's one of the founding fathers of the Home Depot. Very, very philanthropic organization. They are wonderful and they fund a lot of projects, have funded some recovery projects. So again, with corporate foundations, what I would recommend you do is make sure that their mission aligns with your mission. You want to get funding from a company that really supports health related or substance use related, behavioral health related initiatives, and then you might get funded. Healthcare systems and local partners. There are so many different opportunities. Some folks will reach out to their local utility company and get some funds. There's the Southern Company just funded an event that was taking place down at the Carter Center. healthcare systems, like whoever your local hospital is. There are a lot of places that are willing to give funds. We just need to know who they are and how to get a hold of them. So let's move into some required registrations. As we were talking about that grants.gov, again, that website is on some of that information that I sent out earlier. So has anyone, and I wish I could get a
Excuse
show
me.
of hands, I wish I could see you all in the room. A show of hands on sam.gov. Have you ever heard of sam.gov? Have you ever checked out that website? This is really, oh, there go the hands. There, good,
Hey,
awesome.
Em.
Yeah.
Hey, we have the poll right now.
Oh, yeah. Go ahead.
Okay. Okay. Uh, yes. So the poll is, what does
Is
HRS?
the poll up? I
The
don't see it.
poll should be up now.
The poll is up.
Yes.
I don't see it either.
I see
I
it.
don't see it.
Nope.
I don't see it either, Derek.
It's up.
If you don't see it,
There's no
please
poll
don't
on
worry
mine.
about it. If you
Well,
don't
some of
see it,
us see it and some of us don't.
if you don't see it, please don't worry about it.
Okay.
It's okay. It's just, I went over it already anyway, so no worries. No worries.
Okay. All right. Let's end the poll.
So you want me to do it or do you do it?
You got it. Yes.
Okay, okay. So the poll question is what does HRSA stand for? HRSA. And we kind of went over it already, and I apologize. I didn't mean to give it away. But it does stand for the Health Resource Services Administration. I strongly suggest that you check them out. The one thing I will say, and I've said this in the past, the HRSA grants that Georgia Council has applied for, or we didn't even apply for them, we've applied through another organization, which was a university. I strongly recommend that you get to know and be friends with and partner up with your local university. Do it. It's such a great relationship. They want to support you, you want to support them. They are when they apply for the grant, everybody goes, "Ooh!" I don't know what happens at the funders, but they will when they see a university's name and you know that you're going to have a valuation behind it and you're going to have some clout behind it, they are you get a better chance of getting it funded, and they're fantastic partners. I mean, we've partnered with so many universities. They're wonderful. So that's one recommendation I strongly suggest for you. Partner with a university. Either you write the grant and pull them along, or they write the grant and they pull you along. But either way, it's a mutually beneficial relationship. I strongly recommend it. So back to the sam.gov. So we're going to talk about sam.gov. This is important. If you ever want to work in any kind of federal funding, whether you want to apply for a grant for federal funds or you want to be part of a grant as a partner and the funds come from a federal source, this is key. Get yourself registered with sam.gov. Please, if you remember nothing else from today, remember that registering for sam.gov is free. FREE. Don't ever let anyone tell you that you have to pay to register for sam.gov. Ever. If they try to charge you, it's a scam. It's a government website. It's free. But go on there and fill out all the information and register your organization. What they're going to do is they're going to give you what's called a unique entity ID. It's a UEI, unique entity identification number. It's a number, but it really has a series of letters. I believe it's 11 characters long, and that you will use when you apply for funds. And I'm telling you, other funders, when you're applying with them or if you're partnering with them, they will ask you for that UEI also. This is important. And then again, if you're looking for sources of federal funds, grants.gov, set yourself up an account to apply for federal funds. It's free. It is time consuming, but I strongly recommend you do it. And then, of course, you want to set yourself up for state and local grant portals when applicable,
Hey,
including, yeah.
I have a real quick question with that. So I work for RCO, and I'm sure she already has that application number ID. How would I go about writing a grant, even though I work for Bridge Recovery for the new facility?
So, I'm sorry, can you repeat the question?
So I work for Bridge Recovery, or
Uh-huh.
it's RCO, and I know she already has an ID number. But if
Okay.
I'm trying to write a grant, would they give me another number for the same RCO?
Not for the same RCO, no.
Okay.
No, but you can use it again. I mean, you can use the same number again. Yeah, but no, it's one unique entity ID for that organization. You would have to have another 501c3 to get to apply for another
Even if
UEI.
it's an extension into another county?
Well, I mean, if it does it have its own, do you have a separate tax ID number for that?
I would have to find out all that. We're
Yeah.
just now opening up, so I'm just trying to figure out how to write some grants to help Lumpkin County.
Yeah, and you can use that same unique, you know, that
I'll text you
call
or
me. I
email
was
you.
gonna say, yes, shoot me an email, we'll talk about it. But yeah, you can figure it out. There's ways to do it. All right? Great question. Okay, so this is just some more information about sam.gov. This is the actual website. I just thought I wanted to show it to you. Every year you have to update your uh, registration every year. You know, ours comes up in, I think, the end of January. And they give you about 60 days to get your registration in. And they'll send you a notification letting you know that you're up for renewal. You also want to do this with the Secretary of State as well. Keep your renewals up on your Secretary of State, on your 501c3s. And they should send you a notice as well. You just go out to the Secretary of State, and like it says here, you just go to check entity status, and they'll tell you how far away you are from it expiring, and then you just go in and renew.
Hey,
And yeah.
hey, there's another poll
Oh,
question.
yeah, go ahead.
All right. Cool. All right.
Yeah, a quick question. Like my recovery residence is not a 501c3. So how do we maneuver that? Is there like grants for us as well, or how does that work?
I hate to tell you this, but are you a company? Are you a for-profit company?
Yes.
Yeah. Grants are available for nonprofits. I'm sorry. I can't speak to any grants that are available for for-profit companies. I hate to say that, but it's
Emily, can I ask you something about the Secretary of State? I know
yeah.
there's an option for us to register as a nonprofit. I'm already listed as a nonprofit with Secretary of State, but they do have charitable registrations as well. What is the benefits of doing, because it's a whole nother process.
Right, it is. And it's pretty easy though, and they are really responsive. That was a learning curve for me when I took on this role. I had no idea that we had to register with charitable organizations and keep our renewal with the Secretary of State. One thing I'll say about the charitable renewals, I believe that really helps you be recognized as a charitable organization as opposed to just a nonprofit. I'm not entirely sure what the benefits are, but I will tell you that to register to be a charitable organization, that is not free. It's not a lot. It's less than $100 or something like that, and you can do it for 1 or 3 years. But that there is a cost associated with the charitable registration. Just registering with the Secretary of State is I don't believe there's any renewal fee
Yeah,
for,
no, not for your yearly renewal, but
right.
that's what I was wondering about because I saw that on there and I was like, oh, nonprofits, there's a whole different section for, to be registered as a charity. And I was like, what are the benefits to that? So,
Yeah.
and so you don't know what the benefits are either. Is that
I
what,
I
I'm just,
don't. I don't. I know that I mean I honestly I don't know the answer to that. That's a good question, Gina. It's a very good question, but we
have overruns and bingo and gambling that benefit your charity with, and that way you can show with Secretary of State that you can have those kind of functions as a charity that have been, I don't, that's the only thing that I'm thinking that it shows that you can have events with gambling where it's, okay, it's checked off because
interesting.
it's for the charity.
All right, I'm writing that down to look into it. So let's find I'll find that out and I'm glad you brought it up. Thank you.
I
Uh,
was looking at having a Texas Hold'em event
uh,
and that would get people involved, but I don't know. And that's the only thing I think it was sitting there saying that I was looking at the state requirements to be able to have gambling as an activity, as a fundraiser
Okay.
for a charity. And I think you had to be registered as a charity with Secretary of State, if I'm remembering correctly, but my brain gets kind of fuzzy because there's so much.
Thank you.
Thank you.
Okay, thank you. Thank you so much. All right. I appreciate that. Did somebody else want to share? Because we do want to keep moving on, but I want to make sure that if you need to be heard.
I just wanted to jump in real quick, and this is not written in stone, but I think the process is to give you recognition as a 501c3. It's kind of like welcoming you into a pool of others.
There you go. Okay. Very good. Thank you, Robert. Thank you for chiming in. I appreciate the feedback. Thank you. All right. This is great discussion. See, I'm telling you, I learn something new every day. This is wonderful. You guys are great. So, the webinar, I mean, the poll question, notice of funding opportunity, spot on. You guys nailed it. Yes, that is what NOFO. And I did send out a list of acronyms, a glossary that I got. I think Larissa had sent that to me a while back, several years ago, but it's very helpful because you know how we love acronyms in this work, right? So that is what NOFO stands for. The one you really want to watch out for, you guys, is NOA. And that means Notice of Award, which means you got the grant. That's the big one. So yeah, so you definitely want to keep an eye out for Notice of Award. But yeah, good job. All right, so let's go ahead and move on to the overview of the grant process. So the first thing you want to do is identify the opportunity. Oh, wait, real quick. Do we have another poll question?
Yes.
Go ahead.
There you go.
Awesome. Thank you. All right, so the question is, if the grant proposal is due in 60 days, we should start working on it when? This one was a no-brainer. Good job.
Okay.
I'm not I'm worried about you folks saying 2 weeks prior to the due date. That's concerning. Just be careful. We've done that before, but it can be very stressful if you start that late.
Hey, Emily, I've got a
Yeah,
question for you.
sure thing.
So I've tried to go on before and kind of, I'm so new to all of this, and I've tried to go in there and look at some different things. And just to be honest with you, it was pretty overwhelming because some of the numbers are so big. You know what I mean? And I'm like, how do we know based on Recovery Gordon's small. We've got 3 people. We just started. It doesn't make sense that I would go in and be asking for a $750,000 grant, or should I be shooting really high? You know what I mean? Like, how do you know what level of money to go for?
Right. That's a great question, Wendy. Very good. That's why we brought this up, brought that up in the beginning. That's a very good question because if you got all that money, how would you handle it, right? How would you be able, it's going to be overwhelming. So again, so that's where I think the real key is think about your partners. think about it in terms of, okay, if I worked with another partner, could we handle, if I reached out to several partners and we each got, $200,000, so that how many partners do we need to make it 750,000, right? That kind of thing, where, because like a $200,000 grant is manageable. I think any organization, even a small organization like you guys, can handle that kind of money if you manage it right. And anytime, if you ever need help from the council, we will help you. You know, we're even a fiscal agent for some organizations because we want you guys to succeed, right? But
Okay.
that's a really good point. But I would definitely consider partnerships, and
Okay.
and and yeah, and keep that in mind in terms of
Okay.
yeah.
Emily, may
Okay.
I add to that?
Yeah.
I
Hi, Jocko.
okay. Hi. Um well, what I've seen on grants, there's nobody just gonna like if a grant comes and I'm just like I want $750,000, they're gonna say for what?
Mhm.
So I got to produce a budget that shows I am going to spend X amount of dollars in whatever places. So it would be unrealistic for me to ask for $750,000 when my program or whatever I'm applying for is only going to cost 165,000, and that's what my budget says, and that I can account for every dollar.
Right.
If it's 750,000 and I only can account for 165,000, I'm probably not going to get that.
Exactly, Jocko. And we're going to get into that. Exactly. You'll have some details on that. Very well said. Well said. Thank you very, very much for bringing that up.
Yep, yep.
All right, very good. All right, so let's go. Let's get into it. So, again, you want to identify the opportunity, right? Take a look at what it is. Make sure that it matches up with your vision and your mission. Then you want to review the eligibility requirements, right? Are we a good fit for this? Can we meet the eligibility requirements? Are we registered with SAM.gov? Do we have our 501c3 in order? All of those things. Then the next thing is, and this is what Neil used to always say, have a program or a project on a shelf. Have something ready to go so when the opportunity comes, you can take it down, tailor it a little bit to what you need it to be, and submit it. Have something ready. Develop a program concept. Take whatever that passion is and get it down on in a Word document and have it ready to go. Then the next thing you want to do is gather some data, and I'm going to walk you through what that looks like. Gather some statistics and get yourself the statement of need ready, which we'll get into, and who your partners are going to be. Who can you partner with to help you achieve these goals that you really want to do? Just again, you get more done when you partner. Working in silos is just no good. It doesn't help the communities. It doesn't help anybody grow. Community partnerships is really the way to go. Collaboration. Funders love collaboration, and everybody wins that way. So again, so then once you get all this data, you figure out who you want to work with, and then you write the proposal based on your development, your program concept. Then you prepare your budget, which we'll get into, and then you submit the application. So those are your steps. And then let's start breaking it down. The statement of need. This is where you gather that data, you put that data together. You can reach out, and again, this is part of the documentation that I sent out. Has some of the areas where you can retrieve this data. So you can get it from the Bureau of Labor Statistics, the Department of Public Health. There are public health analysts across the state. A lady named Katie Freund is incredible about sharing DPH data from the surveillance. um, it's called the surveillance unit. It's where they gather all the data on where overdose clusters are, or where overdoses have happened in emergency departments, or they break it down by county. You can reach out to the census for population information, poverty information. There's the Uh, there are so many sources of data. If you need any support with any of that, please shoot me an email because right now I can think of the acronyms, but I'm not going to get all the letters correct, and because I'm trying to concentrate on this, but I'll be more than happy to dig into some of those areas for you and help you find data that supports the need. Because you can reach out for national data, you can reach out for state data, and then you can reach out for county level and local data. There's all sorts of database of information available. Describe the problem that your project addresses. What are you trying to tackle? Are you trying to work on reducing overdose rates? Are you trying to build a new program in the jail? Are you trying to, whatever that might be, but describe that problem, identify the population that's most impacted by this, use credible data sources to demonstrate the need. And what I mean by credible sources is I strongly suggest that you stay away from .com sources. And the reason why I say that is because a .com is a for-profit company. Now, I'm not saying that they're doing anything wrong. I'm just saying that they don't necessarily have to provide data that has uh, backup to it. If you go out and you retrieve data from a .org or a .net or a .edu, right? So then you're getting it from sources like peer-reviewed articles. Now, there's no guarantee that somebody didn't fib on that too, but hopefully you get some credible sources of information that are coming from reliable sources. So just be mindful of where you're getting your data and that it's credible. And then you want to explain in detail why action is needed now, that sense of urgency. That's really important because why are we doing this? Because we're seeing people die, and people are coming out of incarceration and they can't get jobs, and people are not getting the support that they need in rural communities. There's so many reasons. So these are where you're going to put your information together to support your statement of need, which is why you're doing this work. Then what you want to do is you want to talk about your target population and try to be as specific as you can here. You want to clearly define who will benefit. Are you reaching a population in a particular county? Is it going to be in a particular region, like a DBHDD region? Is it going to be a certain subpopulation? Is it going to be like like I'll just bring this up because we're doing DHH cares. Is it going to be someone from the deaf and hard of hearing community, or is it going to be someone from the, from the elderly or aging community, or is it going to be the youth community? Again, describe the geographic area served, which again, that would either be your county, or it could be several counties together, or it could be a region, and explain the barriers faced by this population. Just be specific about the barriers that are faced. And you all know what those barriers are because you've lived through them, right? Is it a transportation barrier? Is it a language barrier? Is it a socioeconomic opportunity barrier? Whatever that is, spell it out in the project. And then you want to, again, provide data to support the need for services in your community. I know I have, yeah, go ahead. I know you have some questions. I was trying to take.
I didn't know if you saw my hand up, but
go ahead, Sandra.
Did you put the email? Because I just found the packet that Dwayne sent us. Is your email address in there, or are you going?
It should be. It should be in there. If it isn't, maybe Dwayne, could you drop my email in the chat? Or Derek?
Yes, I'll add your email to the chat.
Thank you, Derek. Thank you so much. Appreciate it. Yeah, Sandra, thank you for bringing that up. Okay, so let's talk about organizational qualifications. So we kind of touched on this, so we'll go over this one pretty quickly. But the mission and history of your organization, right? So what you want to do, oh, this is actually in your proposal. So what you want to do here is you want to define why your organization should be funded over as opposed to another organization. What makes you uniquely qualified to provide these services, right? So say you're an RCO there in Gordon County, right? So you're going to say, well, the reason why we're here is because we are the organization here in Gordon County that can provide these services. There is no other organization that does the work that we do. And what makes us qualified? Well, we're in long-term recovery. We used evidence-based practices. We have been, we have a 501c3. And again, you want to talk about how you have experience delivering similar services, and why you should be funded is so that you can expand those services or continue providing those services or provide new services, etc. And then again, you're going to hear me say community partnerships a million times because it's that important. That's just my opinion. Do what you want, but I believe in community partnerships. I believe in collaboration. I see the benefits when organizations help each other out. I believe it's like peer support, we help each other grow, we help each other thrive, and organizations do the same thing. And it also adds credibility to our proposal. It really does. If a funder sees that you are willing to go out of your comfort zone and work with another partner and work together to provide services, you are more likely to get funded. That's the truth. And then previous grant management experience. Brag on yourselves. This is what we did in 2024. This is what we did in 2025. We were RCO of the year, such and such, whatever it is that you've done. Brag on yourselves and tell them why you're qualified to do this work. And then you want to get into your program description. So, now we've covered the statement of need, your organization qualifications. Now we're going to talk about what you're going to do. What are you going to do? This is exactly what we are going to do. We are going to describe the services that will be delivered in detail. We are going, and this is where we're going to get into this in a minute too, SMART goals and objectives. And I'd love to get a show of hands for anyone who's heard of SMART goals and objectives. Literally, SAMHSA puts this on their application. It says, please use SMART goals and objectives on the NOFO from SAMHSA. It's that, it's very recognized. It's because it works. So we want to know how participants will access these services. We want to know the frequency and duration of services, and we want to know who's going to be responsible for implementing these services, right? Be specific. And let me tell you another thing, y'all. What helps about this is you might submit this grant proposal like on Saturday, right? You might not get it funded until November. You'll find out in November. And if you aren't specific about what you said, excuse me, you're going to go back and be like, I don't remember what we applied for. I don't remember what you said we were going to do. So if you give yourself that grace and put that information in the proposal, then you'll come back to it and you'll be like, oh yeah, this is what we said we were going to do. And so again, just try to be as specific as possible for everyone's benefit. So you want to talk about your goals. You want to have an overall goal, one or two overall goals. Try not to keep it more than two. One is fine of an overall goal, because that's what's going to be by the end of this grant, we will XYZ. Okay? And then the objectives are how you're going to get to that goal. Your objectives are the A, B, C, D, E of how you're going to reach that goal, right? We are going to increase the number of CARES trained individuals in this region by 75. How are we going to do that? Well, we're going to offer Ross workshops. We're going to invite people to come apply to be part of the CARES Academy, that kind of thing, you know? So you're just nailing down specific, measurable steps to achieve that goal. And again, SMART objective: specific, measurable, achievable, relevant, and time bound. Can you meet these deliverables by the end of the grant period? Wow, we gotta keep moving, y'all. We're running out of time. So your project timeline. I learned this, I'm not gonna lie, I learned this from Augusta University. They have been so helpful in helping me learn how to write grants. The project timeline. Look, when is the project going to launch? Who's going to be doing the work? How long is it going to take you to hire the staff and get them trained? Okay? And who's going to be, how are you going to recruit your participants? What's the process going to look like to get people engaged? And how long is that going to take? And then how long is it going to take you to actually deliver the services? So, right, so you're not going to start delivering services on day one. You're going to need time to hire somebody. You're going to need a project coordinator or a peer recovery coach or a transportation specialist or whatever that person is, or whoever those people are that you're going to hire, right? Then you got to get them trained. You got to give them some time to get their device ready to go. You're going to give them some training on how to do whatever this project is. Have a kickoff meeting with your partners and get everything going. And then how are we going to engage people? Well, we're going to, we're going to go out to these events. We're going to do this. We're going to, we're going to, whatever it is that you're going to do to get people involved. And then you're going to deliver services for an X amount of time. And then what you want to do at the very end, and give yourself some time to do this. So if the grant ends on August 31st, by July 31st, you want to stop doing the work so much. You can still continue to do the work, but you want to start that evaluation and reporting period. And you should actually do that monthly as you're going along so that you can see your progress. You want to see the progress. You want to see the impact that you're making. So, budget basics. Let's get into the budget. I love the fact that Jocko brought this up. Budget is so important. It needs to be realistic. How much do you need in personnel? How much are you going to charge for fringe benefits? Fringe benefits cover things like payroll taxes. They cover things like PTO. They cover things like what are some of the other things that PTO or that payroll, or I'm sorry, fringe covers? There's one other key one, I can't think of it right now, but I can get that for you later. But again, so you want to have some fringe benefits on top of your. Go ahead.
Travel.
What's that?
Is it insurance or travel or housing?
Well, so no. So those wouldn't be. Those are not in personnel. Travel's its own line. Do you see that? So travel's its own line. Very good point. I'm glad you said that. Travel's its own line item on the budget. And I want you to be real specific about travel as well. And this is difficult because it's hard to plan ahead. But just remember, like, if you want to go to the Recovery Leadership Summit, or you want to go to the RX Summit, or you want to go to the, Unity Conference, or you want to go to Multiple Pathways Conference, remember to put money in your budget to cover that. If you want to go to the Georgia School of Addiction Studies, if you want to go to Epworth, if you want to go down and do the mental health conference at Epworth, remember to put things like that in. Remember to put the cost of the registration in there. Put the cost of the rooms in there. Put the cost of the mileage to get back and forth from there. Start to think about, and I know it's a lot, but think a year ahead of where you think you're going to be going. And then you want to put local travel in there so that you can meet the needs of this program, right? So you want to keep your staff trained up. And how much does that cost for them to be trained? And what kind of travel are they going to need to meet these deliverables, right? Do you need like 5 trips a week to a rural community? And the thing about this too, about travel too, is be mindful that you cannot ask for reimbursement for commuting to and from your office. That's a no-no. It really kind of has to be travel that's out in the community. And if you need more information on what to charge, the going rate right now for mileage reimbursement is 0.725. And where to get that information is the General Services is it General Services Administration? It's called GSA.gov. I think it's General Services. I can't remember, but I know it's GSA. And what they'll tell you there is what lodging rates will be, what mileage rates are, what meals and incidental rates are for different cities and areas. They're super great source of information for travel related when you're building a budget. They're fantastic. Program supplies. What do you need in terms of supplies? Do you need Narcan? Do you need paper? Do you need toner? Do you need pens? Do you need pencils? Do you need flip charts? Do you need markers? What do you need? Think about that. And then contracted services. Now, contracted services. Let me tell you something about subawardees, which I just learned. In the GOCAT grant, there are subawardees and there are contractors. So, and I did a Google on it. Subawardees are those that are going to actually be part of building the program and be instrumental in building things and participating and designing and all the things associated with your program. Those guys are going to be called a subawardee. They're embedded in the program. Contractors are going to be more like, say you hire somebody to do one thing, like maybe they're going to provide a workshop. They're not really going to they're not going to build anything with the program. They're just going to come. I'm not knocking that. I think that's great, but put them in as a contractor, right? So that there are different categories for how people are but they're all still contracted services. These are folks that are going to be basically you are going to pay them for their work on the grant. You're going to get funding from the funder, and then you're going to pass this money out into other contracted services. And then indirect costs. Indirect costs cover everything that's not covered in the grant, right? So that would be any kind of overhead. That would be any kind of like payroll processing, other admin-related fees that you might need. But that would come out of indirect. And most grants will allow you a de minimis rate of 10%. So you add up all of your direct costs and then you tack on another 10%. Some grants it's only 8%. Some grants it's 15%. But it just depends on the grant. So just keep that in mind. And I know that's a lot. So your budget narrative. Tiffany, you want to ask a question?
Yeah, real quick. So on the budget planning, is it okay to ask for cost for counseling?
Well, what I think I need to have some more specifics. So you're asking, you want to hire a counselor, is what you're saying? You want to hire a
Yeah, so well, we already have one, but just like maybe put in like, would that be under personnel?
Depends. Does that counselor work as part of your, is that counselor an employee, excuse me, is that, is that person an employee of your organization or do you use them as a contractor?
Right. So I guess he would be considered a contractor.
There you go.
Okay, and then my next question real quick would just be, so with transportation, could we add like the transportation for our residents, like where we take them back and forth to work, their meetings, their doctor's appointments and all that?
So that's a very good question. And I think it depends on the grant. It depends on the grant on how that works. So like for instance, we have a grant right now for with the Criminal Justice Coordinating Council. They will pay for the lease of a vehicle, but they won't let us get gas cards. Right. So, and I think, Tiffany, what I would do I think that's a follow-up conversation because I think it would be good for you to hear from other organizations that have gotten transportation funds because I think it varies, and that's a very, very good question. It can be done. We just got to figure out what they allow and what they don't allow.
Okay. I know that we are applying for the Georgia opioid, the one that's
Okay.
due Saturday. So I just
Okay.
didn't know if I could put that in there.
Yeah, that's a great question, and I can get back to you about it if that's all
Okay.
right. Yeah,
Yeah.
give me a call tomorrow or something, and we'll find out.
Okay. Thank you so much.
You're welcome. You're so welcome. Anybody else? There's somebody else, a couple other hands, and again, we're kind of getting short on time, and I still have
Yeah, real quickly.
yep.
Yeah, real quickly. I don't know if some of them misunderstanding or never done it before or what you're saying, but to help you out, what she is saying is whatever you're going to do it from the beginning. Do it from the beginning because you really wouldn't have an opportunity to dip and dab in and out when you submitted your proposal. So you know whatever it is you know you need, do it before you do that. Am
Yep.
I correct?
Absolutely. It's crazy. Like we wanted to use money for a different after we got the funds, we decided at that point that we were gonna do something else, and we had money in the line for the budget, and we said, well, could we just change? Nope, you can't change that. Nope, you put it in for that. So yeah, very good point, Robert. You got to be really careful about what you put in. Now, some funders are very gracious about letting you do budget adjustments after. You can do some revisions after because again, you don't know 6 months ahead of time what's going to happen. You run into things that might come up. So, but if it's not in the budget, they won't put it in there. You have
And
to
don't
get what.
nickel and dime anything. Don't nickel and dime anything.
That's it. That's it. Because once that money's gone, it's gone, and you can't. Right. Good point. All right. So let's talk about the budget narrative. This is very important because this backs up your budget numbers. This is the narrative that goes along with your budget numbers. It explains why each cost is necessary, and it ensures that costs align with your program activity. So again, I was talking about going to these different conferences and things like that, and certainly you don't want to put all of them in your proposal, but if you have one that you're really particularly passionate about attending and you have a good reason why you should attend that conference, this is where you want to really let them know why it's so important that your staff attend this conference. It's because of it will help you meet the deliverables. I really need to keep my certification up so that it will help me meet deliverables. I really need to go to DC so that I can learn about what's going on at the national level so that we can better inform our project. Things like that. You really want to give them reason to understand why you're asking for this money, and provide sufficient detail for the reviewers. Um, Priva, you are writing on the screen, girl. I didn't know if you knew that, but you are definitely coloring on the screen. So again, so if you have any questions about budget narrative, let me know, but it is really important. So again, here we go. Georgia opioid settlement funding opportunities.
Hey,
Yeah,
hey, it's time for a poll.
go ahead.
All right.
Good job.
Okay.
All right, fantastic. Very good, very good, very good. That's right. And Robert touched on this too. So yeah, you've got to meet the deliverables of the grant. It's key. Once you get the funds, you cannot use the money for whatever you want. You have to meet what you said you were going to do with the money. You have to use that money for those specific things. It's that important. Yes. That it's called being good stewards of the money that they give you. And the fact of the matter is, if you
And
are
staying out of jail.
There you go. Oh, there's stand up too. There you go. Exactly. And the other thing of it is when you do that and you show the funders what you're able to do, what happens a lot of times is we meet and then exceed. I'm telling you, Georgia Council's done this so many times. They give us a small amount of money, and it's amazing the work you can get done with a small amount of money. Then what happens is you show the funder that you were able to do twice the work for the same amount of money. Unfortunately, then they don't give you more money. But no, they will give you more money because they see the work that you're doing and they will reward you by giving you more grant opportunities. That's how it works. That's how it's supposed to work, and that's what we hope for you. So again, you Georgia opioid settlement funding opportunities. You want to they support the initiatives addressing opioid use disorder. Remember
Okay,
that.
quick question, just
Yeah,
right there. I've
go
been,
ahead.
when I saw that on the GoCat, they do have that contractor where you can hire people. How specific do you have to be? Like, say, I would be considered probably more of a subcontractor that people would be reaching out to us in a local area to provide some counseling services. When they're submitting their application, how specific are they with respect to the contractors? What are they looking for? Certain licensures? Are they very restrictive? Is it good enough to be a GAC, or are they looking for an LCSW? Um,
So that's a really good question, and that's completely outside of my scope
okay.
So,
of understanding. I don't know.
They're
Okay.
looking at
Emily,
what they're looking at what you say. Okay,
Right.
they
I
looking
get that.
at
I get that. But are they looking, do I have to
if you put
specific?
if if you put RN, that's what it is.
Okay.
It
Oh,
it
so
can't
they,
turn out to be LPN. So they're
right.
going to look
Okay.
at, yeah, exactly what you give them is what they're going with.
All right.
So if
But
you
you have
said,
to stand up to it.
okay. So if you
Somebody,
said counseling in general, you might then be able to select
I
well,
whether,
go ahead,
Emily,
yeah.
I
Jeff.
just asked this question to Taylor today, so I
Yeah.
can answer this. It says in the NOFO, if you're providing
Okay.
treatment, it specifically has to be from somebody with licensure or accreditation. But
Okay.
she told
That's,
me I don't have to list out the specific subcontractors. I can
okay.
work on that during contracting and implementation period.
There you go.
Okay.
But you
Thank you,
That
have
guys.
to
answers the
mention,
question.
All right.
yeah,
Thank you.
you have to tell them that you're going to do it, but you don't
Right.
necessarily have to have the providers' names when you apply.
Excellent.
Okay.
Thank you, guys.
That is exactly it. Thank you.
Yeah, there you go. Awesome. See how we all support each other? I love it. Thank you, guys. Thank you, everybody. All right. So again, prioritize recovery support services and risk reduction. You want to encourage community partnerships. Again, you heard me say it again. I'll say it again and again and again. Encourage community partnerships. And then require measurable outcomes and accountability, right? So we really need to put our money where our mouth is and do the work that we said we're going to do, or to the very best of our ability. And Taylor's fantastic. She's fantastic. So this is I'm sure y'all, hopefully by now, have already seen this site and you've been logged in. If not, I would strongly suggest you hop on there and get yourself an account set up. One of my last slides here is literally just the account. There it is. And this is where you register for the GoCat funds. And I think that's about it. Let me see what other grant. Oh, here we go. I'm going to do the grant writing checklist and then I'm going to open it up for questions. Golly, you guys have been wonderful. So, grant writing checklist. And I submitted two to you guys. I created one, and I'm not going to lie, I used a little bit of AI. Just like I knew what I wanted it to say, and then I asked it to format it for that one checklist. And but the other one, Larissa had gotten while she was getting her master's program for public health, and that one of the professors gave her that other one. That one's a little bit of an older PDF, but take a look at those. Those checklists are so helpful when writing a grant so that you don't forget anything. You want to confirm eligibility for an organizational capacity. You want to review funding opportunity requirements. You want to gather the data and supporting documentation. You want to develop your program plan and develop who your partners are going to be. You want to prepare your budget and your budget narrative, and then you want to preview and proofread before you submit. Have someone else help you proofread. We do it. Yeah.
So the people know you're a property manager, right? Yes, you told them that.
So I think somebody needs to be muted, maybe, because we can hear them talking. There you go. Thank you. So these are some of the just the basic steps. So now it's time for questions, and I want to say thank you for participating. And again, please, please, please provide some feedback about what you think of the presentation. So I see Angela Killebrew has her hand raised, and then we have two other hands raised. Go ahead, Angela.
Hello, Miss Emily. I have thoroughly enjoyed this. Has been so informative for me. But can you explain the GoCat to me just a little, please?
Sure. So it's called the Georgia Opioid Crisis Abatement Trust. So it's GOCAT. And what happened is this funding became available from pharmaceutical uh, pharmaceutical companies that were, I want to say, indicted for causing a lot of the opioid crisis. Pharmaceutical companies negligently supplied opioids out in the community, and so that took years and years of legal battles to get accountability, and the accountability is now coming in the form of a trust, which is funding that comes back to communities. There's a lot of detail that I won't go into with how it's set up, but there's a certain percentage that we're allowed to apply for, and then there's a certain percentage that goes straight to designated projects. But these funds are going to be available to us for hopefully the next foreseeable future, up to 18 years.
Oh,
And
God.
so hopefully we'll continue to get these funds. So what the commissioner has done, for Commissioner Tanner in Georgia, he set up these committees to review applications, and they were really selective about who they have on these committees. They're called RACs. I can't. I don't know, somebody help me out with the RAC, what that stands for. My brain is just mush right now. I can't think of the acronym. But these are committees that help determine who should receive. They review these applications, and they help. So it's not just somebody sitting up on a shelf somewhere, up on a throne somewhere making decisions. It's really committees from the community that are help making the decision about who should get these programs funded. So it's really kind of cool. It's a great concept, and that's where the funding is available. They opened at the end of April for funding for this year, and the grant close date for applications is Saturday. So
And
that's what
and
that
also and also to piggyback on that, I believe there is an explanation on DBHDD website that Commissioner Tanner, yeah, I think they published this, I believe, last month,
Yep.
and it was even on Facebook. So there is more information available. I'm thinking heavily DBHDD website. You should be able to find it, or DBHDD Facebook, maybe even helpful.
Yeah, and this website as well, they'll give you some information here too, about it as well. So this is the actual website for the trust, and there's information about it, and on here as well, and some videos as well. Yeah, thank you, Robert. All right, next question.
Hi, Emily. It's Sarah. I have a question for you. So I am starting a brand new organization, a brand new nonprofit. We are an emerging RCO in Camden County. We have no history of ever receiving grants. What is the best way to approach a grant application or even the GoCat application with no funding? I mean, history of funding, no history of grant funding.
Right, you just tell them the truth. Just tell them the truth and tell them why you will be responsible for. Tell them what you've been doing as
Okay.
volunteers, as a volunteer, all the time that you've put in, and keep records of everything, all the
Okay.
events that you've been to, all the peers that you've served, all the people that you've helped, all the Narcan that you've distributed, all the things, you know, they're going to see that you were able to do, like I said, a lot of work with very little money, right? And
Yes.
they're going to look at you and they're going to say, this girl's got spunk, this
Thank you for that.
right?
You turned it around for me. I appreciate that. Okay.
There was one other thing. I attended the GoCat abatement trust training. Okay.
Mhm.
And the big deal with that is to make sure that you focus on opioid. You can't go
Opioid.
in and say alcohol and opioid. You can treat the opioid person that may also have co-occurring, but
Right, and have that.
focusing, yeah,
Exactly. Thank you, Irene. That's correct. So if you look here, that's why I put this on this, where it says very clearly, support initiatives addressing the opioid use disorder. Very clear. You can do other things, very good, but your primary focus has to be on opioid use disorder because that's where the money's coming from. That's why we have these funds, is to support helping people get well from opioid use disorder. Yes, very good. Thank you, Irene. Yep,
I
go
had a
ahead.
quick question. I wanted to tell Robert Mans that I sent him a private text, a private chat, if he could respond. Thank you.
Thank you.
Okay, I'll look at it.
Anybody else have any other questions?
Yeah, I have one, Emily. This is Macy.
Hi, Macy.
I just wanted to ask, and I may have missed it. Is there a set number of time that you have to be established as a nonprofit before applying for a grant?
For some. Now, for some grants, there is. If you're applying for a SAMHSA grant, there usually is a requirement of being established for 2 years. So, but if from the date that you get your nonprofit status, you can start, and you can even try to say that you provided services before you were able to, if you can say that we were in the process and we were trying to get our nonprofit status, you can go back as far as when you were providing services in the community.
Okay.
But, you got to have it be legitimate, and your legitimacy is establishing that nonprofit. It gives you just that, that basis. That's like your baseline, Yeah. Good question. Good
Thank
question.
you.
There are, yeah. Someone else, Napoleon?
Yes, you spoke of the committee that approves certain things, right? That committee is made up of what type of individuals?
That's a great question, Napoleon. So, if I can find it for you, I know that peers are represented on there. Let me see if I can find. Trying to look it up here um, let me see if I can pull this up. Let me look and see if it'll come up. So each region has a RAC that works best to determine allocations of funds for opioid remediation and abatement efforts with their established regions. So they're in each region of DBHDD. And let me see here if I can find some more information about it. But again, the information is out on their website. I wish I had more time to look it all up. It starts to show it to me and then it takes me to the website. The people to reach out to about that are Holly Lind and Taylor Payton. They can help you understand. And I know Brian's really familiar with. Here it is. It's called. Well, no, I can't. I'm trying to look it up on my phone, Napoleon. I'm sorry, but yeah, if you want to take a look out on, just go to that website, the abatement trust, and they'll explain what those racks are. But again, I know there's college professors. There are state. I believe there are elected officials, possibly. I'm not sure.
506-2144.
Yeah. Did you have another question, Robin?
No.
Okay.
Hey, I've got a question.
Yeah, go ahead, Wendy.
Sorry,
Okay.
I had to transfer to my phone and I don't know how to put my hand up. So I was just waiting until everybody was done.
All right, we got
So
you
I don't
and
even
then
know if,
Will. Yep.
okay, I don't even know if you can answer this, but just in case. So Recovery Bartow has expanded into Make Recovery Gordon. So Recovery Bartow is the 501c3.
Mhm.
And there we got a GoCat for 2 years and they are overseeing it. So we've talked about in the future possibly us, becoming our own entity for Gordon. I guess my thought is, how do you break off? Like if we keep lining for grants that they're having to oversee because they're the 501c3, how do we branch off and move into our own?
So that's a really good question. I mean, it sounds like you're almost answering it yourself. So the idea is, do you establish your own 501c3, or do you use Recovery Bartow as your fiscal agent to do the work? But again, and you can do that too. You can operate they can operate as a fiscal agent, and you do this. But again, if you want to branch off, the idea is you're going to have to set up a whole new 501c3 to stand alone as your own organization. You don't
Right.
have
Well,
to
I
do
guess
that.
it's the time. I guess it's the timing. So I have to be under them for 2 years because they're handling our GoCat
Yep,
grant.
there you go. Yep.
But then,
Did you sign a
But you,
Did you sign a contract with them?
mm, I don't know what you mean.
so I got another
Uh,
hand up. I got another hand up. Let's
Okay.
let's
okay.
see if we
Okay.
can come
Sorry.
back to
Thank
that.
you.
Okay. Yeah, yeah, thank you. Hey, Will, do you still want to ask your question?
I did. Thank you. It's kind of in line with some of the other questions were asked with newer 501(c)s. I know that some grants require some, a couple of years of data, and then there are others that don't necessarily require that timeline of data, but they're not going to approve it without it. What would you suggest in terms of, a first year nonprofit? What would you suggest to pursue?
In terms of what types of funding to pursue?
Yeah, yeah,
So that's a great question. So, if you can stay local, so if you establish relationships with local funders, like, a local corporation that you do a lot of business with. So,
right.
let me give you an example, right? So, what I'm trying to do now is we're going to be moving over to a different IT company that supports nonprofits. And it's not going to be a whole lot of money, but I'm hoping that they'll do something, whether it's in-kind donation or it's an actual financial donation to our organization. And they're going to have very limited requirements of us. They're going to give it to us because they're a good organization. And the thing of it is what you want to do is push the fact that it's tax deductible for a company to do that. They will write it off on their taxes. They're saving themselves, tax burden by donating to your organization. That's what I would recommend. I don't know about anyone else that has more recommendations, but and then the congressional district spending. They are specifically required to put this money back into the community. They want to give it back to the community. If you send them an application to show that you're doing work, they're not going to ask you for a whole lot. They just want to know that you're in the community, that you're doing good work, and they'll fund it. Um, so they have very limited, restrictions and requirements. So that's another direction to go.
Okay, that's good info. Thank you.
Yeah, you're welcome. And I've got Gina Lee, and then I think we're going to be out of time. Gina, can you ask a minute question?
Yes, I didn't see any links or anything on the Hersha or that was that.
It's not in the packet?
No, I didn't see any links or anything on it.
Go to HRSA. I think it's just HRSA.gov, HRSA.gov. And if you need to, shoot me an email and I'll get it to you. That's a good question. I'm sorry about that. I'll add it.
Okay, and do y'all have any insight on a good search or whatever for using Candid in the Foundation Center? Because I know we can go to the local library, like your main library, and search for it there. I've done a lot of stuff like that. But are there keywords or something that you could do that would bring up a good search for us for that?
Let me think about it and get back to you because we're all out of time. But that's a good question. That's a good question. That's a really good question. Let me see what I can find. Okay? From Guide Star and Candid, right? Okay. Derek, are you still with me?
It's the Foundation Center. That's where you can go and search, and you can get like all sorts. You can get every type of funding that you were talking about that's listed there. Private, company, the foundations, the government, everything through the Foundation Center.
Okay.
Yes, I'm still with you.
Okay, great.
Um,
Yes.
Again, thank you, Emily Ribblett. Just another round of applause for Emily. Thank you. Thank you again. Um, and how can people go about getting in touch with you? Is via email okay,
Yeah,
Em?
email's perfect. Email's perfect. I hope you guys got a lot out of the material.
Okay, okay. So, and then certificates, also for certificates, you'll be able to get your certificate next week from Alvin Cotton. Please be able to look in your mailbox. It will be sent out sometime next week from Alvin Cotton and be able to search in your mailbox for Alvin. Um, the presentation slides, I think I think they were sent these already, correct?
I
I
don't know
got
if
them
I sent.
earlier today.
Yeah,
Yes.
Yeah,
this
Okay.
year.
they're one of the 7 attachments. They're in one of the attachments.
Thank you, thank you, thank you, Dwayne. So you guys already have gotten aside to send the attachments that was sent over. And yes, remember to please save your CEUs. You get 1.5 CEUs for attending this training. And remember to submit them in December of 2026.
Yeah, you guys were great.
Uh, Again,
Thank
thank
you.
you again, Emily Ribblett.
No, thank
Thank
you.
you.
This was
Thank
great.
you.
All right.
Thank you,
Okay,
Emily.
Have a
everybody.
good one.
Why do we
Thank you.
have questions in
Good
the
night.
chat and those weren't answered? We had some questions in the chat.
Let me see. Let me see if I can find him. Hold on. Can you give me a specific question?
About the difference between a grant proposal and filling out a grant application.
1 second, really quick, really quick, really quick. For those that stayed for the duration of the hour and a half, you are good to go. If you do want to stay afterwards while Emily knocks out these last couple of questions, you can, but you'll receive full credit. You're good to go.
All right. So who just asked that question? I just want to address you. Who was it?
Heather. Heather.
Heather? Hey, Heather. So you're asking what's the difference between a grant proposal and a grant application?
Yes.
Okay, so the proposal itself is basically what you're putting all together. The application is where you're putting it. That's really the difference because it's basically, and I will tell you sometimes what you need to do with that proposal is apply, send it out to multiple funders because if it doesn't get funded one time, then you might want to save it and send it to another, put it in another application. But basically, they are kind of interchangeable. Good question.
You could use the same proposal for several different applications.
You can if you haven't gotten it funded, so in other words, so if say you have a proposal that you put out in 2024 and you didn't get it funded in 2024 and you want to try it again this year, you can do that. Now, of course, you want to go back and then update everything and put in the correct dates and change some of the things. But yeah, you can use the same idea of a proposal. Absolutely. Yeah. Yeah.
Thank you.
You're welcome. Great question. Anybody else? What other questions did we have that I missed? Anybody else?
Wyatt said, how long do you have to be an organization before you can apply for grant funding?
Right. And again, so I think we covered that one. That depends on the application. If it's a SAMHSA grant and you're a recovery community organization, they may ask you to be in operation for 2 years, for a minimum of 2 years. And some applications will have a minimum, but a lot of applications don't have any minimum. And they may just, and even if they do, what you can do is you put in what you've been doing as a volunteer. Put in everything that you've been doing, that that you attended this, you attend all these events, and you've come to ARAD, and that you've done this, and you've been an advocate, and you've all the things that you've done without getting paid for it. put that in the application to show them that you have the credibility and that you're the willingness and the desire, to do the work. Anybody else? I'm happy to answer any questions that you have. I'm so excited that you guys are so interested in this, and I wish you all the very, very best in writing grants. I really do, because it's hard work. It's yeah. Angela, did you have something?
I was just going to say thank you, Emily. You're the best.
You're
You're the
welcome.
best.
You're welcome. You're so welcome. You guys have a great evening and enjoy Memorial Day weekend.
Oh, and I did want to say I had put it in the chat when you were talking about the different populations, whether it's the elderly, the this, to that. I put in, I want you to put in a line for dual diagnosis.
Exactly.
Yes,
Exactly.
please, please, please.
Yeah. Mm-hmm. Good point.
Is
Yeah,
there a
thank you.
survey we have to fill out in order to get our CEUs? Is there a survey at the end of this?
No, there's not a survey.
There's no
And I
jot
should have.
form or anything that we need to get our CEUs.
No.
No, you have
Okay,
your
then.
name on there and everything. Yeah, I should have put a
Got it.
link in there for feedback though.
Yeah,
Thank
it
you.
was excellent. Excellent. Thank you.
You're
And
welcome.
I already saw stuff in the chat where they're looking for part two, like grant writing 201, you know what I mean?
You
You'll
bet.
get a full room again. Thank you very much.
Thank
Thanks,
you,
Derek.
Robin.
Good night.
Good night.
All
All
right.
right, everybody. If everybody got you, did I miss anybody's questions? Y'all good? All right. Take care, everyone. Thank you so much.